All right, very good. And let me just, one more thing. I just got to get myself up in the picture here. There we go. And good evening, everybody. My name is Tom. I'm an alcoholic, but I'm also my goodness, it's so funny. I'm so used to going to meetings on Zoom. That's how I introduce myself these days. Welcome to Kimmie's Recovery Zone. We are a recovery community organization, independent nonprofit organization led and governed by representatives of local communities of recovery. And we aren't talking about geographic like Fort Myers, Bonita Springs, or Naples. We're talking communities of treatment centers, recovery residences, hospitals, uh, treatment and recovery organizations, providers, services, and uh, business communities that are recovery focused and advocate policy activities and try to also support community education and outreach programs and provide peer-based recovery support services. This is the final episode. Final session. We did 5 sessions prior, and I want to thank everyone who has been attending these sessions. And it really is very, very, very important. And as we're going to get into this, for people who've been impacted by the disease, limited understanding of why people do what they do, what this is all about, how to support them, uh, wanting answers and not even sure what the questions are, and also to try and overcome hopelessness that may exist within about the future of themselves and their loved ones. We have covered the disease concept and chemical dependency, family systems, family roles, signs and symptoms, codependency, communications, skills, and tonight we are doing pathways to healing. Now, who is a family program for? And again, as we said, family and friends of alcoholics and addicts who have been impacted by the disease. As we have said earlier in these sessions, disease, alcoholism, and addiction is a family game. Everybody it's not a spectator sport. Everybody gets to play. People who have a difficult understanding why their loved one behaves the way he or she does. They don't understand about the complexity of the disease of chemical dependency. They don't effectively know how to support their loved ones because this is like walking into dark woods without a map. And again, having questions about the effect and impact of addiction. And one of the good things about a program like this is that people get to share. I am monitoring the chat. So if you want to put anything up there, if you have a question, if I'm going too fast or whatever, I'll do my best to slow down and be able to respond to your questions in a timely manner. And I want to also try to do my best to eliminate the severity of hopelessness about the future of everyone involved because of this disease. Now, many people with loved ones suffering from addiction experience their firsthand impact, experience firsthand the impact of the disease as well as their relationships. The construction of the addiction process is complex, entails genetics, environment, memory, motivation, mental illness, reward. It's the brain chemistry components of this disease. The family's overall understanding of this process is crucial for supporting their loved ones through treatment and recovery, and to find out that the support that comes through as excuse me, as we'll get into this, um, learning how to take care of oneself on multiple levels is one of the best ways to support your loved one who's going through this. But our experience, my experience, every one of these recovery communities knows that once a family is educated, they can increase the quality of their own lives as well as enhance the dependent person's chances for success in treatment and recovery. Uh, the family, the family working a successful recovery program as well is vital to the success of anyone getting sober. The goals of this program has been to create better pathways to healing by identifying family roles, family systems, breaking down the rules that have been guiding the path of the family into dysfunction, and making it, easier to shift the family structure from maladaptive toward adaptive behaviors. And this is a process known as restructuring. This is where therapy helps direct change in the family patterns of interaction into recovery and healing. And we're going to get into this in just a minute, because this whole session is going to be a very quick review of what the highlights were of the different topics that we covered, with directing towards healing processes and how we can do this. And I would be more than happy to answer questions. But again, I would also like to say that all the sessions are up on the Kimmie's Recovery Zone website, where if there's a topic that when we covered, if you would like information, you can go to that. You can actually fast forward into the presentations and stop and play from the parts that are highlighted of interest. So right now, like I said, the first session we covered the disease concept and chemical dependency. And we'd always talk about chemical dependencies being the elephant in the living room. And as you can see, our dependent friend there saying, what elephant? And our little elephant friend here with the detailing the different parts of that elephant: the awkwardness, the avoidance, the reluctance, the denial, the diversion, the silence, the ignorance, and of course, his trunk. Now, dependency, what are the causes? And these causes are also identified as risks, that if you have a genetic predisposition, the likelihood of someone becoming addicted when they start using is significant. If someone has a mental health disorder or an emotional disorder, these things, they have, some maladaptive coping skills with painful feelings, anxiety, depression, isolation. These are very significant contributors to substance use disorder. Peer pressure. This is, people who want to, especially in teenagers, are seeking an identity. This is, their friends are doing it. I actually remember being, when I was in my early days as a counselor, interviewing a group of adolescents, and I asked them what they said about peer pressure. And I was immediately corrected by a couple of them, saying, we don't call it peer pressure anymore. We call it peer acceptance. And that was a very, very powerful statement for me to hear at that time, because of how many kids are trying to fit in these days. The lack of family involvement. If there's two parents that are working out of the household and they're leaving the child caring or child rearing to someone else, or if there is a separation, divorce, a single family household, a single parent household, these increase the risk of addiction. Early use of drugs. I know that the brain doesn't stop developing until the age of 25. And again, that is something that is the likelihood of causing brains to rewire, because the reward circuitry hits those buttons, real quick. And then taking a highly addictive drug, stimulants, cocaine, opiates, crack cocaine, smoking, anything that gets into the bloodstream faster increases the potential exponentially. The three top drugs, and they rotate in order: heroin, crystal meth, crack cocaine, and a close fourth is alcohol. And the family disease being characterized by enabling or active use, impairment in behavioral control. As you can see, what we talk about is that this happens to everyone in the family because they get caught up in it, whether they may not even be using any substances. The family members are more likely to be functioning or psychiatrically sicker than the primary addict. And that affects everyone in the family. Again, the diminished recognition of significant problems, otherwise known as denial. And that denial becomes very progressive. And that creates a dysfunctional emotional responses. You're not reacting to situations normally because you're using your emotions rather than rational thought. And it's rational decision making is going out the window. And these characteristics manifest in the dysfunction of the family. And speaking of the family systems, again, made up by multiple parts that are linked together. Remember the little example of the mobile, that, the rods and the strings are what would be known as the rules and the structure of the family and the functioning. It's, the functions for the family system are to establish attitudes, values, and goals. It determines who's in authority, how is it going to be used, and what that authority is. And it doesn't mean that the authority is the disease at all times. And sometimes it's, how the person who is the dependent person is behaving, being the authority figure in the family. And sometimes it's the family members of how they react to it. And that's the authority, the unspoken rules that go on. And the other rules are to understand and anticipate how families will deal with change within the family unit and in the relationship with the outside world. In other words, how they manage everything and everybody inside the environment and outside. And that part of that management is how they communicate with one another and what they communicate about. And that's a very big thing, because the three primary rules become: don't talk, don't trust, and don't feel. See, because this way, if somebody outside starts getting in and communicating that, hey, there's a problem here, and why aren't you noticing this? This will disrupt the system that's going on, that's in place of keeping that dependent and that family system active. And again, the dependent is the central focus of the family. And when we describe the roles, if he had a line, it would always be, get me a drink. The enabler is the person holding it together, denying everything, the secret keeper. And, enablers can also not only just be parents or spouses, spouses and parents, but they can be roommates, lovers. The oldest child becoming, and, if it's depending on the household and the family structure and the dynamic of that family. And that the enabler's line is always, everything's fine. And the hero, usually the oldest son or daughter, most helpful in the family, overachiever. Okay, they're always they're always trying to fix and mediate what's going on. And again, here we put out, what if this child was 9 or 10 years old? What should a 9 or 10-year-old be doing? Not caretaking or parenting even. And that line of that particular character is, I'll take care of that. The scapegoat, again, most often the second child, never achieving the same status as it's always, mom liked you, always loved you best type stuff. And they withdraw from the family, and they become too attracted to others who are similar to him. They usually get into trouble, and they usually become addicts or alcoholics themselves. And they usually have very low self-esteem. And their line would be, I'm out of here. Lost child is a middle child. Simply withdraws, deals with hurt, avoids everything, shuts themselves off, emotionally and socially withdrawn, and literally removes the lost child does not have a line because they're just gone. And the mascot, usually the youngest child, vying for attention by seeking attention that is distracted and lighthearted. See, because they can't do the attention thing like, oh, why aren't you paying attention to me? Because that behavior will cause the authority figure to squelch that behavior, and usually the lightheartedness is to avoid the put down and to do distracted and try and bring some more positive emotion to the family. And that line would be, do you want to hear a joke? The enabler leads a life of depression, isolation, and stress, but with help, experiences serenity and improves his self-esteem. When they learn how to take care of themselves, they can better care for others. The family hero is usually a workaholic, is bitter, full of emptiness, and outwardly is is successful and achieving, but that's all you get to see. But with help, they can become a leader. The scapegoat can have a life of substance abuse, destruction, and early death. But with help, they can deal with reality and become a great counselor. And the lost child can be depressed, isolated, but with intervention can be usually is found to be creative and imaginative. And the family mascot can be immature forever, but with help can learn how to deal with problems rather than vying for attention, be outgoing and personal, and still be the life of the party. And here we get to see what the system dynamics are. And we look at, if literally you look at some of these things. So if you look at this and you try to find yourself and in that role, I want you to understand something about these roles is these roles are fluid. As people move out of the family system, roles change. Lost child actually could come back into the picture. The scapegoat could become the hero. The mascot usually becomes the hero. The hero can become an enabler. They'll find these relationships in other families that they either attach themselves to or create, and they perpetuate these problems. When you identify these symptoms, you change the payoff and you change the possible price. The pathways to healing for the family members are interventions, where somebody gets in there and says, this has got to stop, either through the dependent, and if the dependent goes off to treatment, if the people can get involved with a family program and family counseling through that treatment center, which all of them offer, that's a good thing. And the different levels of treatment are primary care, residential, partial hospitalization, outpatient, intensive outpatient. Then there's the aftercare programs, which are usually support groups or counseling, the lower levels that are provided for post residential or post intensive outpatient. There's recovery programs, which is AA, Al-Anon for the family, AA for the addicts, or NA, Al-Anon or Nar-Anon for the family, and then ongoing support is in therapy. And always remember, you're gonna hear more and more about therapy going ongoing to provide maintenance for the things that heal. And then there's also mutual aid groups. If someone should have died, someone dies from this disease, and death is a common occurrence. There's grief groups. If there's, medical issues that happen, there's medical support groups, cancer groups, kidney groups, all sorts of things. There's also one of the best forms and most common forms of mutual aid is a church or a religious order or whatever you may be attached to, a congregation, excuse me, that was the word I was looking for. We get into signs and symptoms. It's very interesting because this is one of the things that helps the education. When you can see things starting to happen with the addict, about the denial, the obsession that life is revolving around using and their compulsion to use, and they're getting emotionally and physically ill, you start recognizing those characteristics and you start looking at other members of the family, not only if you're looking at yourself, but you also see the denial. You see the obsession with the person using. The dependent becomes the drug of choice for the family members. And then the compulsion to control the person using, either an urge to cure or an urge to enable. And the emotional and physical illness as a result of those behaviors manifest. And again, we look at these things in those roles, the signs and symptoms. You look at the feelings, you look at the symptoms of what happens, the payoff for the individual, the payoff for the family, and the possible price. Again here. So these are things that change, that if you recognize these feelings, you start getting to these, you can get into different opportunities for therapy, for treatment, medication, whatever it may be. The physical symptoms, physical, emotional, spiritual, mental is a combination of all three. But the physical symptoms for the addict is craving, tolerance, accidents, nausea. For the person closest to the addict, headaches, back pain, vague sickness, unexplained injuries. There's so many outward things that happen to the person. The emotional symptoms for the person, for the addict, anger, picking fights, shame and guilt, self-centeredness, depression, hypersensitivity. For the family member, it's the same: irritation and anger, fear, financial worries, shame, guilt, isolation, depression, and hypersensitivity. And the spiritual symptoms: loss of belief, the conflict between behavior and values, the low rate of violating moral standards, the things that that person would be willing to do to get a drink or a drug. And then, because the need is is in control. The disease is in control of the addict. And for the person closest to the addict, the loss of belief or the constant effort to try and make things right. It's not a lot of gray area in between there. It's black or it's white, and it's very changed. And then the other part is the grandiosity of the family member or low self-esteem that we can do this, we can't do this. And then the rigidity or hardness of heart, that the numbness that comes from that person. But the other part is in that rigidity is manifest in hopelessness, and it's just a very sad state of affairs. We get into codependency. Again, codependency is driven by the agreement that I will work harder on your problem and your life than you do. This is not love. Codependency is often used casually to describe relationships where a person is needy or dependent. And there's a lot more to this than just clinginess. A person who is codependent plans their entire life around pleasing another person, or the enabler. It's both ways. Addicts and alcoholics are codependent by nature because they need to have somebody to fulfill their need to be impaired. In the simplest terms, one person needs the other person, who in turn needs to be needed. So that enabler is always going to be letting the dependent dominate them. And that circular relationship is what they call the cycle of codependency. And the 6 hallmarks of codependency: an excessive or unhealthy tendency to rescue, to derive a sense of purpose and self-esteem through extreme self-sacrifice to satisfy others. And they choose to stay in lengthy, high-cost caretaking. And high cost, we're not talking about money. We're talking about physical, emotional, spiritual expense, trying to do this rescuing of saving a relationship at any cost, and mostly the cost to themselves. And they regularly try to engineer the change of troubled, addicted, or under-functioning people whose problems are far bigger than their abilities to fix them. They also seem to attract low-functioning people. This is like, on the other side, low-functioning people looking for someone to take care of them so they can avoid adult responsibility or consequences. Or they attract people in perpetual crisis that are unwilling to change their lives. It's always, that need to be, that sometimes the chaos or drama of someone's life is what they need and what they want and how they exist and how they find their purpose. And others have a pattern of engaging in well-intentioned but unproductive behaviors. And that is, ultimately described as enabling. Codependency, these are important factors. It's a learned behavior. This is not a genetic predisposition, although it is, rooted in family behaviors, but it is a learned behavior. It is not, there is actually no diagnosis for codependency. It is passed down from one generation to another as a behavior, not as a, as a genetic generational pass down. It is an emotional behavioral condition, and it affects an individual's ability to have a healthy, mutually satisfying relationship with another person. You know, it's also known as relationship addiction. You'll find that people are jumping from one relationship to another. So somebody says, you know, I really can't take you anymore and I'm going to get better, but you need to too. And that person will choose to leave the relationship to go find another one. That happens all the time. I've seen it way too many times. And they are one sided, emotionally destructive. And most times, a significant percentage of times, there is a level of abuse that is occurring in that relationship. Who do they affect? The person closest to the dependent person, a spouse, a parent, sibling, friend, coworker, significant other. Um, they're the partners in chemical dependency. You'll see lots of, you know, couples, you know, or roommates that are, you know, equally bad, but somebody's always a little worse. But there's definitely, uh, you know, a shift in power. Persons living with or in relationship with an addicted person. Now, the other part is people in relationships with chronically or mentally ill individuals. So, substance abuse sometimes is it's a primary disorder, but it may not be the most driving or glaring attribute, for lack of a better word at the moment, of that person. And then any codependent person from any dysfunctional family. And that is a really broad statement. Any dysfunctional family. You'll find that sometimes if you know people that are come from a really dysfunctional family, they attach themselves to other dysfunctional families. Codependency recovery is very important. They have as much difficulty accepting their powerlessness over people and events as alcoholics and addicts have regarding their powerlessness over their drugs of choice. Again, the person, the dependent person becomes that codependent's drug of choice. Letting go of the need to control people and places and events is difficult, but will ultimately set us free of our self-defeating patterns. And the self-defeating patterns are shame and fear. We talked past about shame and guilt, and I'm going to get into shame and guilt again. Guilt is I have done something bad. Shame is I am bad. And the guilt is more external, that becomes internalized, you know, also takes on that emotion, but it is very external, outward. Whereas shame sometimes is put on you, or like when you're a child, people learn shame because it says, oh, shame on you, you know, and they get shame placed on them. But the thing is, though, they internalize that and there's no outward exposure or work towards how do I get out of I am bad, I am not worthy, and all that negative self-talk that occurs from shame. And the investment in caretaking and control take a lot of our energy. So learning how to let go of that helps us to become more productive. Remember that your life is self-directed. You find your way through life by personal control, good decision-making, and independence. And this is really important because we're going to get into a couple of things towards the end of this that are really great tools that, and I'm going to have a really bad metaphor for you, and because you know me with metaphors, and but it's going to help because when you start learning about the choices you make being yours and yours alone, you'll understand how we develop the ability to make really good decision making. Communication skills. I love Calvin. And Calvin and Susie just yell at, they just don't have the greatest relationship. If they were married, that would be a new standard of toxic. Thank goodness they're not. Stephen Covey, a really great business management and person, said the most important ingredient we put into any relationship is not what we say or what we do, but what we are. That becomes our legacies. You know, what is going to become our legacy? And if our words and our actions come from superficial human relations techniques, meaning if we're being phony, everybody's going to smell right through it. and they can sense that duplicity. They can see it. It's palpable about somebody being phony. They're lying. They're manipulating, um, and they're just evasive, avoidant. People can see through that in a heartbeat. And when that happens, you can't create or sustain a foundation necessary for effective interdependence, meaning a mutually satisfying relationship. And communication is the foundation of all of our relationships. The foundation of all our relationships. Everything you say or do. When somebody walks into a room, their body language communicates. The way they dress communicates. The way they present themselves communicates. The way they sound communicates. How they greet somebody right from the get-go. And what that expression that is most popular is, you can't get a second chance to make a first impression. Well, I don't fully believe that, but those first impressions are always lasting. So the communication tips that we talked about, the knowledge bases, and this one, we went into some really deep stuff with these about passive aggressive and assertive communication. We talked about the difference between manipulative and submissive communication. We talked about fair fighting rules, and this one you're going to have to go back to last week's presentation because there are some really good things about how to learn how to do fair fighting. Skills development and communication, which we're about to get into, because that's part of that pathway to healing. Active listening is one of those things, and that in itself is just learning how to be present in the moment, and the active listening tips for trying to repeat when somebody says in for clarity, for understanding, and for cooperation. And what comes out of that is compassion. Conflict resolution is another skill on how to deal with almost everything involved in a family situation. And how do we develop better communication skills? We set aside time to talk without interruption or distractions. When you're making time for somebody else, you're proving to them that is a communication right off the bat. Just you're demonstrating that you already are interested in what they have to say, because you are freeing yourself. You're putting your phone in somewhere else. You've turned the TV off. You're facing them, and you're really making time for somebody else. And where that's ever most prevalent, look at what you do with children. And I'm not talking about little children either. I'm talking about even anyone who is a generation below you. That still, there's always going to be that thing. Think about what you want to say. Don't just jump headfirst into it. But don't be thinking about what you want to say while somebody else is talking. Listen to what they're saying, then think about what you want to say, and then respond, as opposed to when somebody's talking, you're already thinking about what you want to say, and you might be missing a point of what they're trying to make about, which can be relevant, very relevant to how what you say is going to be received. Be very clear about what you want to communicate. Keep it simple. Use just a few words. Nail in the head, that's for sure. It's not about the nail. I love that one. That was great. Make your message clear so that your partner hears it accurately and understands what you mean. Take the emotion out of it. Speak slowly, speak clearly. Don't have food in your mouth. Don't have your hands over your mouth. And don't have any distractions going on. Talk about what's happening, how it affects you. I need, I feel, I fear. We're going to get into that in a second as well. Talk about what you want using those I statements. Accept responsibility for your own feelings. Because honestly, you're the only one that can make you feel the way you feel. Other people can influence stuff, but how you respond has a lot to do with some of these behaviors that have been learned that are rooted in codependency, if you're a family member, that are rooted in dependency, if you're the dependent. But the thing is like, am I dealing with my feelings appropriately? Listen to your partner. Put aside your own thoughts for the time being. Try to understand their intentions, feelings, needs, and wants. And this is demonstrated as empathy. And I just have to just get through this chat thing here so I can get that thing to stop flashing. Um, Sharing positive feelings with your partner about what you appreciate and admire about them and how important they are to you. A compliment goes a long way, especially if it's sincere. Remember the statement that Stephen Covey said, if you're using manipulative techniques or you're lying or BSing, you can smell it a mile away. Be aware of your tone of voice. Sometimes when you lower your voice and you talk to somebody slowly, you're going to have more impact on them than if you stood across the room and shouted at them. How many times has somebody gotten real close to you and gotten a little quiet, and all of a sudden boy, do they have your attention. Negotiate and remember that you don't have to be right all the time. If the issue you're having is not that important, let it go or agree to disagree. Compromise is a big thing here. There's a couple of great expressions. Do you want to be right or do you want to be happy? And a usual alcoholic answer is, I want to be right and I want to be happy. Or how important is it? What is this going to mean a week from now? Mean to you in a week from now? A month from now? There are times when I'll be talking to clients and they're all really nervous about, going back to work. And I said, okay, if you go in there, how you behave is communicating. Your fear is, they can feel it. They can cut it with a knife. But understand this. Think about who was in the news yesterday. Who was in the news 3 days ago? Who was in the news a week ago? You become yesterday's news real quickly, especially if you're not doing anything. If you're doing all the things you're supposed to be doing, you're not newsworthy. And they're going to look and sniff around for somebody else to pay attention to. Now we're going to get into pathways to healing. We covered all of these things about these different things that we talked about on the different sessions, different topics, excuse me. And now this is all about how do we make this happen? Okay, first off, find a therapist. Because a therapist is going to guide family members through healing tasks. And those healing tasks are working in the present. Interactional processes. They're going to look and see how your behaviors manifest, how you communicate, how you behave. What are your routines? The domains of that are in the active, in the passive, in the positive, and in the negative. And they look at these processes, and there's almost 12 different domains that can be looked at by a good therapist. Reframing negativity. If you change the way things look, you look at things, the way you look at them change. You look at things, turn your thinking around. Look at it from the other side. Start with the opposite. Get rid of the absolutes. It never, it always, it must, it should. Get into that stuff and create a little flexibility. The reversals, they're talking about changing your habits. Do the opposite of what you usually do. Break the patterns of those maladaptive behaviors. Look about and start looking at your boundaries. Who are you aligned with? Who are you associating with? How often do you let people walk all over you? But look at, and my first recommendation when I tell anybody about boundaries, especially when you have a boundary with another person, is never tell the person what your boundary is, because they'll come crashing through it every time. It's almost like the nature of an addict or an alcoholic. Oh God, tell me you're not going to talk to me and I'll take care of that. I'm going to start talking. You're not going to bring me that. I'm going to come get it. Don't just, okay, thank you. Just let them know. You don't have to let them know anything. Detriangulation. Triangulation in a family system is absolutely commonplace. You got one person playing off another, so they get, and then these two start getting, I mean, it happens all the time. We stop doing that triangulation, and sometimes you have to just step away from the triangle yourself. I'm not playing that game. I wasn't part of the problem. I'm not going to be part of the solution. Because sometimes if you try to be a part of the solution of somebody else's problem, you become the next problem. Opening up closed systems is one of the big things about conflict resolution. And closed systems are all of those things in a family dynamic that are really, like not letting any other people in. Don't talk, don't trust, don't feel. This is how things are. We're not deviating from this because we don't want to disrupt this, what's going on, the secrets, the use, the emotions. We're keeping all of that the way it is. And then developing tasks. A good therapist will give you tasks to orchestrate change. And those tasks, when you start changing those, trying those new tasks, you develop new skills. These are very important. This is a very important factor because the tasks are all within the first 6 of those. Resiliency is the next thing. Okay, so these first, working on the 6 or 7 things to work with a therapist who can guide you through those things. But truly effective work comes out of the individual. And what is resilience? It means being able to jump or bounce back. You all possess a certain degree of strength, and you can accomplish several things. And you accept reality, and that you have that life has meaning, and that you can improvise. That's the big thing. You know what's going on. You can see it. You can do it, and you do it, and you actually take action. My really bad metaphor is at the end of The Wizard of Oz, when Dorothy's holding the broom of the witch after they melted her, and Glinda shows up, and Dorothy says, "Now I just want to go home." And what does Glinda say? "Oh, but my darling, you have always had the power." And she had the ruby slippers, because the ruby slippers enabled the power, the resource. All she had to do is click her heels 3 times and say, "There's no place like home." And boom, she winds up back in Kansas. This is really important because we all have the power. It's just so buried and deep inside of us because of all the layers of the maladaptive behaviors, all the layers of guilt, all the layers of shame, all the layers of fear. There's no way we can even see through that film of, that's so cloudy that to be able to find and help ourselves. So the way to build resilience is learning from the past. If you don't learn from your past, you're condemned to repeat it. Look at the insights that you gained from something. Did it work? Did it not work? Build on strengths. Build away from weaknesses. Okay? But the other part is, when it says here, don't forget all the triumphs that addiction recovery isn't just about the addict. We're all in the addiction recovery here as family members. Okay? What worked? What did you do that worked? Because sometimes it was just one thing out of 10, and we look at it as like an abnormality, an anomaly, like, oh, that was a fluke. No, that was the right thing. Everything else was just a massive amount of flukes that, changed the norm or the mean. Acceptance is a really big thing. Change occurs every day because today becomes yesterday tomorrow. And that's change. That's life. Okay. The resiliency, you start learning how to adapt. Sometimes you can't wait for tomorrow to come. And sometimes, either like, I can't wait for it to get here so I can get at it today, or, oh my God, I'm going to dread tomorrow. How do we look at things? Change is going to happen. What am I going to do tomorrow? What did I do yesterday that's going to help me tomorrow? People, having people, have a support system. The most powerful words in the world in our universe are, I know how you feel. Finding them, finding those people, having a few of them in your support, in your network, in your life, in your inner circle, and then but just sometimes having a lot of other people around just to be around, to be social. Got to take care of yourself. Period. Physical needs, eating, sleeping, exercising, hydration, shelter, clothing, all those basic needs are part of self-care. Okay. Meditation, spiritual, exercise is not only physical, but it's also emotional. Exercise combats depression and anxiety 100%. There's always a change in somebody's level of depression or anxiety when they start practicing and sticking to a quality exercise regimen that is progressive. Gratitude. A grateful heart will never suffer. And when you ever get into a place when you're trying to find gratitude, stop everything you're doing. Spend 5 seconds. Look down at your shoes. Literally stop and look at your shoes. Get into the moment. I am safe. I am secure. My needs are being met. Bring yourself into the moment. Not a moment's past and not the moments to come, but be in the moment and be grateful for being okay in that moment. Recovery capital is the next thing. So resilience and recovery capital. It takes capital to build a business. It takes capital to make an investment. So recovery capital is an investment in yourself. And it shifts the focus of the pathology of addiction, which means all the negative maladaptive behaviors, to a focus on the internal and external assets, community, all the things that are required to initiate sustained recovery from alcohol and drug problems, of which being a family member of a dependent is an alcohol or other drug problem. So how do we build it? Okay. Start using these concepts. There are more important things to me in life than using or being around people who are using. That's a challenge. In general, I am happy with my life. Start practicing that gratitude, which is an important thing. I have people in my life who love me, who care for me, who care about me. I have enough energy to complete the tasks I set for myself. I can do this. I'm building my self-esteem. I'm building my self-worth. I'm building my self-confidence. I value myself and I value my world. I'm proud of the community I live in and feel a part of it. I get lots of support from my friends. How many friends do you have? We all have lots of friends. I regard my life as challenging and fulfilling without need of being around people who use or using myself. Again, family members can start developing those maladaptive patterns of substance misuse as well. Or other things, they compensate with work, food, sex, religion, shopping, exercise. When it becomes an obsession, that becomes the new need. Where you live, your space, be happy where you are, clean it, take care of yourself, make your bed. Guys, go on YouTube, look up Admiral McRaven, the Make Your Bed speech. It's actually the University of Texas 2014 commencement speech. It's 20 minutes long. It's awesome. Taking responsibility for my actions, that it's so important that, I'm the common denominator in all my problems, but I am also the common denominator in all my successes, which is really an important thing. And TD, thank you. Yes, it was an awesome speech. And I'm happy dealing with a range of professional people. If you can find people that are, supportive, those therapists, the people running your congregation, mentors, people within your HR departments, you know, um, financial people, lawyers, doctors, all those people that have spent a lot of time becoming really good at what they do to provide help and service to somebody else. And yes, we can be talking about plumbers, carpenters, electricians, any landscapers, you don't have, if it's not your forte, hey, you're dealing with them. And note the progress that you're making on your recovery journey. If you've gone another day without having to, get yourself into a chaotic situation or keep yourself free from drama, that's progress. Now, here's a couple of things that I love showing to people. Recovery means finding your path to a meaningful life because it puts you in control of your life and helps you gain self-confidence and respect for yourself. Your recovery, which you are doing, is self-directed. You find your way through personal control, good decision-making, and independence. The choices you make are yours and yours alone. Your path is based on your needs, likes, and experiences. If you see it as an ongoing journey, you'll always be able to find the best physical and mental health along the path. It empowers you. You are the only person who can turn your decisions into actions. You are in control of your destiny. And it also includes your mental, physical, and spiritual needs. It includes your family, friends, job, and community. That speaks to the resiliency factors and the recovery capital factors. And it's going to have, your recovery is going to have ups and downs. That's the acceptance. It's not a step-by-step process. Life gets lifey. It's a long-term process. You grow and build on your successes and you learn from your mistakes and your setbacks. It's based on your ability to bounce back. There's the resiliency. Value yourself, build on those strengths, learn new things. Self-growth is personal fulfillment is a huge part of recovery capital and resiliency. But also learn how to use support from others. Don't be afraid to ask for help, or don't be afraid to be inclusive. Bring somebody along with you and say, hey, you want to do this with me? Even though you could do it alone, share the joy, share the love, share the experience, share the wisdom, share the education, just share. Make friends. And it's a great way of building relationships. Leaders don't say, follow me. Leaders say, let's go. That kind of thing. It's a great leadership skill. Your recovery lets you respect yourself, believe in yourself, meet your goals, take pride in what you can do, and accept it graciously. You can have pride without being, cocky, for lack of a better phrase. And your recovery shows you can take responsibility for yourself. Find the courage to work towards your goals. Keep going. Stick to it. And your recovery gives you hope. You can overcome your problems. So, what we always say to family members, how do you help yourself? Make a commitment to take care of yourself, get professional treatment, or joining a self-help 12-step family program, and you'll develop mutual support. Don't deny or minimize or cover up for not only the problem that somebody else has, but acknowledge it of what it has done to you and to everybody that you care about. Learn about what you can do in those programs, those mutual aid groups, and you could say, hey, why don't you try it? If they don't want to, it's like, okay, now you're going to start developing a boundary. And you start learning how to be patient and supportive. Patience and support are boundaries. Remember that. Patience and support are boundaries. Lower your expectations. There are no shortcuts or easy solutions in this, but recovery is possible, so don't give up hope. Remember, you didn't cause it, you can't cure it, you can't control it. And you can't find their bottom for them. Their recovery is their journey. So in closing, I want to read something to you. And this is something that The family program I used to do up in Arms Acres in Carmel, New York, we always closed our family program with this. It's called letting go. Letting go does not mean to stop caring. It means I cannot do it for someone else. Letting go is not to cut myself off. It is the realization that I cannot control another. Letting go is not to enable, but to allow learning from natural consequences. Letting go is to admit powerlessness, which means the outcome is not in my hands. Letting go is not to try to change or blame another. It is to make the most of myself. Letting go is not to care for, but to care about. Letting go is not to fix, but to be supportive. Letting go is not to judge, but to allow another to be a human being. Letting go is not to be in the middle arranging all the outcomes, but to allow others to affect their own destinies. Letting go is not be protective. It is to permit another to face reality. Letting go is not to deny, but to accept. Letting go is not to nag, scold, or argue, but instead to search out my own shortcomings and correct them. Letting go is not to adjust everything to my desires, but to take each day as it comes and cherish myself in it. Letting go is not to criticize and regulate, but to try and become what I dream I can be. Letting go is not to regret the past, but to grow and live for the future. Letting go is to fear less and to love more. And remember, you can kick the elephant out of the living room. I want to thank you all very much for participating in the Kimmie's Recovery Zone family program. You can view us on YouTube anytime you want. Also like to just put a plug in that we are a nonprofit organization and our income is based on fundraising. And for those of you who have donated, I want to extend my sincerest gratitude on behalf of Al and all and Eric and all the partners that are working very hard to make Kimmie's Recovery Zone a much more important resource in our community. And it has been my honor, my privilege, and my pleasure to have been able to bring this presentation to you. And that I hope that if there's something that else I can do, and you can contact me through the Kimmie's Recovery Zone organization. If there's any handouts or flyers that you would like me to send you, please put it up there in the contact form, and I will make with your email address, and I will make sure to do that. I want to say thank you once again on behalf of Kimmie's Recovery Zone, and that I'm really grateful you were all here.